These days, breast cancer tends to get more attention, but lung cancer continues to be the deadlier disease.
But now an Orlando doctor is on the verge of creating a first-of-its-kind lung cancer screening. And as Laura Diaz explains, his inspiration comes from man's best friend.
Ears perked up or nose to the ground, little Lexi is always on the hunt.
Come on, baby.
And crazy as it may sound, it was actually Lexi's impulse to sniff that led the Scottish Terrier to her greatest discovery.
I was babysitting my daughter's Scottish Terrier, and it kept jumping on my back and jumping on my back and jumping on my back.
After a few days of Lexi's antics, Janet ended up at the doctor's office.
That's when they found the tumor, the cancer tumor.
An 8-centimeter mass, twisted and contorted, wrapped around Janet's heart and attached to her backbone.
So it really was a shock. I thought I had osteoporosis.
At 54 years old, Janet was told she had stage 4 lung cancer.
No, I was a non-smoker. If it had gone undetected, I would have been dead in 3 months.
But thanks to Lexi, the cancer was found.
Alrighty.
Janet started treatment immediately.
I'm going to hit the bottle again.
And now, 2 years later, the cancer is under control with monthly chemotherapy.
And this is not a fluke. Scientists have proven dogs can smell cancer. In fact, California researchers found they can train dogs to detect the deadly disease 99% of the time.
They don't know what they are smelling, but they know the smell of lung cancer.
Now Janet's doctor,
How's it going?
Real good.
Tariq McHale, a Florida hospital thoracic oncologist, is hoping to use that animal instinct to create a computerized screening test that would detect lung cancer before it's too late.
So you breathe into a machine, the machine takes that exhaled gas into that card, and that card would change color. The computer would analyze these colors and say this is the stamp of lung cancer.
The chance for an early diagnosis could eventually mean a cure.
If they could do that with your yearly physical as a preventative, it would be amazing.
Dr. McHale's working with doctors from all over the country on this study. He says he expects to have funding to begin research by the end of this year with results possibly in the next 2 to 3 years. So it's right around the corner.
Yeah, and Laura, this story really hits home with me. My mom dies of lung cancer, but she was a smoker. This young lady, non-smoker.
Was a non-smoker, and it's not as rare as you would actually think. In fact, women who've never smoked, they account for 20% of patients diagnosed with lung cancer. So tomorrow morning at 6:15, I'm going to explain why lung cancer is just not getting the attention it deserves. You know, breast cancer, takes the majority of that.
Great story, great breakthrough, huh?
Yeah, really.
All right, don't go anywhere. Here's what we're working on for tomorrow night at 11.
So last night at 11, I showed you how a Florida hospital doctor is on his way to creating the first ever screening test for lung cancer. But why has it taken so long? Why doesn't lung cancer get the same attention and funding as breast cancer when it's killing more women?
Janet Wolick never smoked a cigarette a day in her life. She has no family history of cancer, but here she is, 56 years old and battling stage 4 lung cancer.
It was 8 centimeters, and it was wrapped around my heart and attached to my back.
Janet was diagnosed 2 years ago, and while her cancer is under control thanks to monthly chemotherapy treatments, there is no cure for lung cancer.
You know, with breast cancer, you can get a mammogram, but there's no way to really detect lung cancer until you have symptoms, and then that seems to be too late.
Janet's doctor, Tariq McHale, a Florida hospital thoracic oncologist, is working with doctors from across the nation to create a screening test that would detect early stages of lung cancer. He says despite lung cancer's deadly numbers,
more women die of lung cancer than more women dying of breast cancer.
It can be difficult to get the research funding the disease deserves. You see, lung cancer has what you might want to call a public relations problem. Many believe the patient did it to themselves by smoking.
What I personally like to resist is the idea that we should blame lung cancer patients for their cancer. I think we will not advance the science if we continue to do that.
And when you look at the growing numbers of non-smokers being diagnosed with lung cancer like Janet, you have to ask, doesn't everyone deserve a chance to fight for their life?
I want to be here. I want to see some grandchildren.
Well, the numbers are truly startling. Lung cancer kills 200 women a day. That's more than on any other cancer. 20% of these women will have never smoked. When you look at the money, it's the least funded cancer in terms of research dollars per death. According to a recent study done by Brigham and Women's Hospital in Boston, breast cancer gets about $27,000 per death in research money. Lung cancer, just over $1,200.
Yeah, I like how you put that in the piece about the PR problem.
Right.
Because, you know, a lot of people think, you know, you did this to yourself.
Anytime you hear lung cancer, you think smoker.
Totally agree, and that's as you just mentioned, not the case all the time. Okay.